This conference will now be
Dr.
recorded.
Dr. Mangesh Deshpande, sir. He is a accomplished pure Ayurvedic practitioner having special interest in bone, joint and spine disorders, running successfully first Ayurvedic hospital in Dombivli, which exclusively works in the field of bone, joint and spine disorders since 9 years. He also practicing in Shivaji Park, Dadar. He has treated more than 6,000 cases of rheumatoid arthritis, ankylosing spondylitis, post-viral arthropathies. He is associated with Dr. Anil Herur, renowned oncosurgeon and HOD oncosurgery, Fortis Hospital, since last more than 4 years for cancer research and registered more than 300 patients for Ayurvedic palliative care treatment. He also has an expertise in Ayurvedic medicine preparation and Panchakarma treatments. He has received a prestigious Bishop Warrior 2013, which is a Doctor of the Year award by Brahman Sabha Vaidyakiya Samiti, Dombivli, for dedicated work in the field of social and medical fraternity. He has been a speaker for bone, joint, and spine disorders at many reputed institutes and conferences such as World Ayurveda Congress, various reputed Ayurvedic colleges, national and international seminars, various regional news channels. He is also an educator and provides health consultations, panchakarma therapies, and comprehensive workshops based on the authentic science of Ayurveda. He is also a writer for various Ayurvedic magazines and journals. With this brief introduction, I request Sir to start his session. Thank you. Sir, please start. Thank you.
नमस्ते शारदे देवी वीणा पुस्तकधारिणी विद्यारंभं करिष्यामि प्रसन्नां भव सर्वदा हरि ओम. Thank you very much, Dr. Chinmay Fondekar sir. I am very happy, very glad to be part of this Bheshaj Parishad, and he has given me a task, drug designing, mainly related to rheumatology. Rheumatology is a very vast field, but we can take 3 or 4 different examples related to this kalpo, or related to designing of a kalpo in rheumatology. There are 5 6 main aspects related to drug designing. Let us go one by one into it. We all know this Chikitsa Sutra: Langhanam, Svedanam, Tikta Deepanani Katuni च, Virejanam, Snehapanam, Bastaya च, Amamarute. See, uh, if you are choosing Langhan as a specific karma, then which type of dravya you will use? If you are choosing Svedan, you know the indications, contraindications, arhata, anarhata related to Svedan with respect to Amwal. Now you have to choose a dravya or a group of dravya, that is kalpa, for Svedan. How will you choose that? In case of, see, it is written Tikta Deepanani Katunicha. So in case of first thing, in case of Pachan, how will you choose Tiktaras? Tikta plus Shita, Tikta plus Ushna? How, when, where, in which sthan? That is very important. So according to Chikitsa Sutra, we will be selecting different type of dravya. So there are some specific things related to it. First is, it is chosen with the help of guna. So in Langhana Bruhaniya Adhyay, guna vishesh is described in this manner: yat kinchit laghava dehe tat langhanam smrutam. What is langhan? रौक्ष्यम खरत्वम वैशद्यम यत् कुर्यात् तद्धि रुक्षणम, दिस इज रुक्षण. स्तंभनम स्तंभयति यत् गतिमन्तं चलं ध्रुवम, लघु उष्ण तीक्ष्ण विशद रुक्षम सूक्ष्मम खरम सरम कठिनम चैव यद्द्रव्यम प्रायः तत् लंघनम स्मृतम. All these things are related to Langhan. Ruksham, Laghu, Kharam, Tikshnam, Ushnam, Sthiram, Apichilam, Prayashaha Kathinam, Chaiva Yadravyam, Tadhi Rukshanam. These are Rukshan Dravya. What is Stambhan? Sheetam, Mandam, Mrudu, Shlakshnam, Ruksham, Sukshmam, Dravam, Sthiram, यद द्रव्यम लघु च उद्दिष्टम प्रायः तत् स्तंभनम स्मृतम. So if a patient comes to you having complaint of stambha in a knee, in particular joint, say knee joint, or in say a spine, then there is a combination of shita, manda, mrudu, shlakshna, ruksha, sukshma, drava, sthira, combination or permutation combination of these guna. So if a patient comes to you with stambha in his knee joint, and in according to his history, he says that I eat ice cream daily, so it is shita, manda, plus sthira. So because of shita, manda and sthira, he is getting stambhan. Opposite to it, that is, say, ushna, manda, opposite tikshna, and chala, chala or sara, opposite to sthira. These type of dravya, these dravya includes these gun can be selected, and that can be used in stambhan of a particular joint. So this is guna vishesh, and which is very much important in case of any dravya or kalpa to be used in uh, treatment point of view. Say you can see this. I hope you all are getting this. I am going towards last column, that is stambhan. Guru, Shita, Mrudu, Drava, Ruksha, Manda, Sukshma, Shlakshna, Sthira. So, two or more guna are involved in stambhan. The first row shows karya, and the other rows are denoting different types of guna. So if you are talking about Langhan, then Laghu, Ushna, Tikshna, Vishada, Ruksha, Sukshma, Khara, Sara, and Kathina. These set of guna to be used for Langhan. If you want Swedan for your treatment, then the dravya should be of Laghu, Ushna, Tikshna, Drava, Ruksha, Sukshma, Sthira, or Sara. So, if you are talking about Swedan, then the dravya should be Laghu and Ushna. Laghu, Ushna, and Tikshna. Drava, Tikshna, and Laghu. Ushna, Drava, and Sukshma. These type of permutations are to be used with the help of gun. So how to use it? See, according to Bhav Prakash, you can refer Bhav Prakash for that, and you can choose dravya with the help of Bhav Prakash. A patient comes to you with, say, stambhan, guru, shita, and mrudu are the guna that are the main culprits related to stambhan. Then you have to think of laghu, ushna, and tikshna dravya. So go to Bhav Prakash, C. Laghu, Ushna and Tikshna Dravya. Laghu, Ushna and Tikshna Dravya plus it should be Sandhi Shulahar. Sandhi Shulahar, Laghu, Ushna, Tikshna. That is to be used, and that is to be used to for Stambhanahara as Stambhahara in case of joint pain or in case of say polyarticular arthritis. If you want a karma of say Svedan, then you can select set of Tikshna, Ushna and Laghu, and you can use Dravya according to these guna, uh, according to Bhava Prakash. So like that, first is you have to select Hetu, which Hetu are main culprits related to the particular Vyadhi or particular Lakshan. Then you have to select Gun, set of Gun, permutation combination of Gun, that is number 2, step number 2. And after that, opposite Gun are to be selected, Dravya of opposite Gun are to be selected. But not only that, you have to see sthana related treatment also. If a patient is of Grahani, then Grahani Hara plus Laghu Ushna Tikshna is to be used. If you want Janu Sandhi Hara, Sandhigata Vata Hara medicine, then you have to select Dravya accordingly. First is Gun, second is Sthan is to be selected in this case. And then we can see these things. So this is a picture or a table I have read in say Guna Visheshanka of Ramesh Nanal sir, and see Ruksha plus Shita. Ruksha plus Shita, you can see Ruksha plus Shita in 6th column, that is Stambhan. So opposite gun are to be used in Chikitsa, that is Snigdha and Ushna. Stambha, Todavata Vedana are seen in Ruksha plus Shita Ahar 7, for which you have to use Snigdha and Ushna in Chikitsa, that is Jambir, Ajmoda and Shatapushpa. If it is Ruksha plus Sukshma, then you can see Ruksha plus Sukshma. This is also related to Stambhan, and Stambhate, Patyate, Spotayate, Ayamyate. These are the symptoms seen in case of Ruksha plus Sukshma combination, for which you have to use Snigdha plus Sthula, Gunadvandva Vichar. Snigdha plus Sthula and Shaliparani Priyal Majja can be used. According to this, we can use medicine. So how to select a medicine? How to select a medicine with the help of Chikitsa Sutra, Langhanam and Svedanam. Only two things I will try to simplify. Langhanam, Svedanam, first column and second last column. If you want to go ahead with Langhanam, you can use these combinations of guna for the treatment. You can use upvas also, you can use vyayam also, you can use different type of medicines also of these set of guna. Laghu, Ushna, Tikshna, Vishada, Ruksha, Sukshma, Khara, Sara, Katina. If you want to go ahead with Svedan, Laghu, Ushna, Tikshna, Drava, Ruksha, Sukshma and Sthira can be used. So चिकित्सा सूत्र के अनुरूप कल्प निश्चिति Then another example, I would like to give you another example. Ushna is one of the predominant gun for Vyadhi Nirmiti. If Ushna and Snigdha is combined, then it is Urdhvaga pathophysiology. If it is Ushna plus Ruksha, it is Adhoga pathophysiology. It is Ushna plus Snigdha, Urdhvaga Samprapti, and it is Kafanubandhi. If it is Ruksha plus Ushna, Adhoga Samprapti, it is Vayu oriented Samprapti. So, what is the Sandarbha or reference related to it? In case of Vyadhi Nirmiti also, Guna are very important. So, in case of Kalpa Nishchiti also, Guna are important. In case of Vyadhi Nishchiti, Guna are important. And Paraspar Virodhi Gunatmak medicine are used in case of Chikitsa. This is the reference of Rakta Pitta. In case of Rakta Pitta, if Ushna is associated with Snigdha, then it is Urdhvaga Rakta Pitta, Kapha Samsrushtata. If it is Ushna plus Ruksha, it is Adhoga Rakta Pitta, Vayu Samsrushtata. So these two are main basic things. If a patient comes to you with Urdhvaga Rakta Pitta, you can easily go ahead with Ruksha and Shita Chikitsa. If it Adhoga Rakta Pitta, you can think of Snigdha plus Shita Chikitsa. It is very simple. So I will not going to tell you about what dravya or kalpa to be used. I will tell you that Snigdha plus Shita is useful in Adhoga Rakta Pitta. Ruksha plus Snigdha is used in Adhoga Rakta Pitta. So according to Guna, we can use our uh, Yukti Praman, and then can give different drugs. Then we can use Sariva, we can use Vasa, we can use Nagapushpa, Nagakeshar, we can use Durva according to Guna Vishesh. It is very important. The next important point is Sthan ke anurup kalpanishchiti. According to Sthan, which kalpa is to be used is also very important. In this sutra, it is written, Pratyekam sthana dushyadi kriya vaisheshyam acharet. Every time we are taught that those are important. Yes, those are very, very important in case of treatment, in case of chikitsa, in case of chikitsa. But more than that, important is sthan. If it is not that particular avayavgamit, if the drug used or drug chosen is not going to that particular organ or to that particular srotas, then it is in vain. If it is vatagna dravya, it is the vatagna dravya, but it not at all. It has no affiliation or gamit towards say garbhashay or say raktavasvatas, and then the treatment will not give you improved result. So pratyekam sthana dushyadi kriya vaisheshyam acharet. Sthanam pakvashayadi, pakvashayadi, that is pakvashaya, amashaya, etc. Dushyam rasaraktadi, and adi grahanat avarana grahanam. Avaran. Avaran is Vayu to Vayu or Vayu to other dosh, Kapha and Pitta, or vayu to other dhatu, that is raktavrita vat, mausavrita vat, medavrita vat, etc. So these are avaran in this case. Another example related to um, gamitva vichar or related to sthan. So if a patient comes to you with shita, first we talked about ushna, now we are talking about shita. If shita is associated with snigdha, then it is kapha predominant samprapti. If it is kapha predominant samprapti, stambha is the cardinal sign or what we call it as pratyatma linga. If a patient of shita plus snigdha gunatmak samprapti, then kapha vruddhi is there. Stambha is a cardinal sign and it is amashaya samutha samprapti. If patient comes to you with ruksha plus shita set of samprapti, then it is related to vayu pradhan samprapti. Kampa is the cardinal sign or pratyatma linga in this case, and the samprapti is pakvashaya samutha. So shita plus snigdha, kapha pradhan, stambha is the main sign. Then it is amashaya samutha. If it is shita plus ruksha, it is pakvashaya samutha. Now, how to treat it? Virodhi gun with the help of opposite gun. So, if it is Shita plus Snigdha, Kapha Pradhan Samprapti, Stambha Pradhan Samprapti, Amashaya Samutha Samprapti, in which you have to use Sutra in Charak Vimanstha, that is Pachana Vamana Apatarpana Samarthani Bhavanti. Amashaya Samuthanam Vikaranam Pachana Vamana Apatarpana Samarthani Bhavanti. In case of Shita plus Ruksha, Vayu Pradhan Samprapti is there. Kampa Pradhan, Lakshan or cardinals or Pratyatma Linga is there. This is Pakashaya Samutha Samprapti, in which Sneha Virechan, Shodhan Basti, Lavan, Lavanottar Prash are to be given. So, what is important is sthan. First important is Chikitsa Sutra. According to Chikitsa, you should understand Guna Virodhi Chikitsa is very important, for which you have to take reference of Langana Bruhaniya Adhyay. In this case, Sthana Anurup Chikitsa Kalpanishchiti, somebody's mic is on. If possible, please mute your mics. If possible, please mute your mics. First is according to Chititra, and the second is according to Sthana. Please mute your mic. This is the second important sutra in case of, mainly in case of rheumatology. Pratyekam sthana dushyadi. It is everywhere. You can. It is important in case of Raktapitta also. It is important in case of Jwara Chikitsa also. Whatever the Udbhav sthan is, Deha, Indra, Mana, Santapa, Jwara, no problem. But the main thing is related to Amashaya. It is Amashaya Samutha Vikar. So you should not go into details of Deha Santap, Indriya Santap, Mana Santap. You treat Amashaya by Pachana, Vamana, Apatarpan, Samarthani Bhavanti. And if you treat Amashay very specific and with minute detailing, then only it is possible for you to get rid of Jwara Chikitsa. Now, these are two important things. First is Chikitsa Sutra, second is Sthana. Uh, Sthan. So, according to Sthan, now we will be going into details of Sthan. Amashay, we all know about Amashay. I will go into details of Pakvashay. These Sandarbha, this reference is related to Acharya Sushruta. Pakvashay. There are two main uh, differentiation or main parts of Pakvashay. There are two separate parts. One is Pittashay, second one is Vatashay. In case of Pittashay Dosha Dushti, you please refer Sushrut Samhita for this and Tika or Dallan Tika also, very important in this case. And in this case, Pittashay, in case of Pittashay, you have to use Tilvak plus Eranda. In case of Pakvashay Dosha Dushti, but in case of Vatashaya Dushti, you have to use Sneha Basti. Poor Vataj symptoms are there. Think of Pakvashay Samutha Vedi. Think of Vatashay dash Pakvashay Samutha Vedi and use Sneha Basti for that. If it is Pittashay Samutha dash Pakvashay Samutha Doshadushti, then you have to use Virechan as a treatment as a treatment protocol. So, case of Pakvashay, see only one sthan, but still, but there are two separate sthan in Pakvashay. One is Pittashay and upper one, and the last one is Vatashay, which needs first uh, in case of initiated Vata. Now, in case of Vatashaya Gatavad, in case of Vatashaya Gatavad, there are three subtypes in Vatasya. All Lakshana are there written in your textbook. Please go through it. I will not be going into details of it. You can read Lakshana, signs and symptoms, and according to that, you can choose treatment protocol. If it is Malavrutta Vata, then in all cases, Vatashayagata Vata, in all cases, you have to use Ksharabasti only. Kshar is used in case of Pakvashaya Vedi. In case of Pakvashaya Samutha Vedi, first think of Kshara, then think of Amla, then think of Virechana. So you can go to any Ayurvedic medical shop and you can see all purgatives. If they contain Kshar or Sandhav or Betavan plus Amchur or Amladravya plus different Amladravya, then think of Pakvashayagatavat. So if it is Amashayagatavat, pick the Katu Pradhan Dravya are there. If it is Pakvashayagatavat, then always remember it is Lavana, Kshar, Amla, Dravya. In case of Malavrutta, Vidari Kalpa plus Sneha plus Ksharoshna Basti are to be used. In case of Kapha Vrittavat, Kshara Ushna Basti plus Mutra is used. Just a minute, if it is possible, na, I will all the mics. Just a minute. Hello. Now I think all mics are closed, muted. Anyway, so if it is Malavrutta, go ahead with Vidari Kalka plus Sneha plus Ksharoshna Basti. Bhedan is important in all these cases. In case of Kapha you have to go ahead with Ksharoshna Basti plus you have to add Tikshna Mutra, mainly Gomutra. In this case, filtered Gomutra is to be used along with Ksharoshna Basti. And the third one is Shita Ksharabasti in case of Pitta Vrittavad. In case of Pitta Vrittatva, Shita Basti is used, Shita Ksharabasti is used. In all cases, Malavritta, Kaphavritta, Pitta Vritta, in all cases, one has to go ahead with Ksharabasti. Now, there are Churna Basti also. There is a sutra, you can see here, Churna Basti Cha. So it is Tika of the Chakrapani in Charak Samhita. I think it is related to Siddhistan. Churna Bastischa. We use Churna Basti in case of Amavad. We use Vaishwanara Churna Basti in case of Amavad. We give say 10 or 15 grams of Churna and uh, 12 times or 14 times Ushna Jal is added for say 1 to 2 hours. Then we immediately filter it and we administer Churna Basti. So if you need Srotas Shodhan, please start with Churna Basti. If you need Dosh to travel from Shakha to Koshta, please administer Churna Basti. So Churna Basti are very important in case of Amavruttavad, in case of Samavastha also. So स्थान के अनुरूप कल्पनिश्चिति. Now the next thing is there according to Srotas, there are Sroto Viddha Lakshan according to Acharya Sushrut and Srota Dushti Lakshan according to Charak Samhita. According to Sushrut, Sroto Viddha Lakshan, according to Charak, Sroto Dushta Lakshan. So these medicines can be used in case of these Srotas. If it is Annavah Sroto Dushti, you have to do Amapachan, then go ahead with Shunthi and Ajmoda. If Annavah Sroto Dushti is associated with Kapha, Kapha Samsrushta Annadushti is there, then think of Shunthi. In case of Vataj Annavah Sroto Dushti, think of Ajmoda. What is Vataj and Kafaj Annadushti? You can go ahead with Hetu. Which Hetu are there in case of Vyadhi Nishchiti? Please evaluate the Hetu further. If the Hetu are Kafakar, then go ahead with Shunti. If Hetu are Vatakar, then go ahead with Ajmoda. If Lakshana, signs, cardinal signs, Pratyatma Linga are related to Kapha, then think of Shunti. If it is related to Vat, think of Ajmoda. In case of Rasavaha Srotodushti, think of Tulsi and then after Pachan, go ahead with Shatavari as Rasayan or Balya Dravya. In case of Raktavaha Srotodushti, think of Guduchi and Sariva as a drug of choice. In case of say Vatarakta, the main thing is Saukshmat Saratvat, Vatadushti happens, and Dravatvat Saratvat, Raktadushti happens. So, Viruddha Guna Yukta medicine which has affiliation towards Sandhi are to be selected and used in case of Rasavaha Srotodushti, Raktavaha Srotodushti. In case of Mausavaha Srotodushti, Chitrak and Vishatinduk are used. So if a person comes to you with Parkinson's, go ahead with Chitrak and Vishatinduk. Patient with Medovah Srotodushti comes to you, think of Devdar and Bhallatak. Patient Devdar and Bhallatak can be used in case of Medovah Srotodushti. If a patient of say first degree osteoarthritis comes to you, that is medial compartment loss osteoarthritis, if this patient comes to you, then think of Devdar and Bhallatak. In case of Asthivah Srotodushti, think of Kokilaksha and Panchatikta. In case of Majjavah Srotodushti, think of Ashwagandha, Amalaki. Asti Majjavah Srotodushti, Uduchi Amalaki Musta, Ardha Shloka Samapana. That is a drug related to Vishamajwar. And Erandamul and Pippali are used in case of Shukravah Srotodushti. All are related to Sthan. So in case of Katishul, you can use Eranda, but think this way. How to use Eranda? With Eranda with the help of Trivrut, if it is Grudrasi plus Gulma. It is if Grudrasi plus Urugraha is there, piriformis syndrome with sciatic pain is there, think of Eranda Sneha plus Gomutra. If it is with Katishul, think of Kshira plus Shunthi with Eranda Sneha. According to Sthan, you have to think accordingly. So, first was related to Chikitsa Sutra, the second was related to Sthan, third is related to Anupana. Maharasnadikvat. So, Sarvavata Roge, Maharasnadikvatha. Rasna Dviguna Bhaga, Syad Eka Bhagas Tatha, and so on. So, in this case, you can see the red lines. Ebhihi Krutam Pibet Tvatham, Shunthi Churnena Sanyutam, Krishna Churnena Va, Yogaraja Gogulana Athava, Ajmodina Ajmoda Dina Va Api, Tailena, Erandajena Va, Sarvanga Kampe, Kubjatve, Pakshaghate, Avabahuke, Grudrasi, Amavate Cho, Shlipade, च अपतानके अंतर्वृद्धौ तथा आत्माने. So this is sutra written in case of Maharasnadikvat. So there are n number of anupan. So which anupan to be used in a particular case? A patient of Amavad comes to you and he is telling you all the symptoms. A patient of Amvat comes to you with Aruchi and clamor. He says, I am very much tired, and if you press any of my organ, I feel very better. I feel good. This is clam. Aruchi, clam, Aruchi plus clam are there. Then it is related to Malasanga. If a patient of rheumatoid arthritis come to you saying, I have nishthivo, that is extra salivation, think of apakti, think of Agni-mandya, and with that you can give Shunthi Churnena Sanyutam Krishna Churnena Va in case of Maharasnadikvat plus Shunthi Churna or Krishna Churna. Amvat patient associated with alasya comes to you, then the main cause is Anila Mudhata. Go ahead with Ajmoda as main prakshep dravya of Maharasnadikvat. Many a times patients come to you, see, very important, many a times patient comes to you with Balabhramsho and Gaurava. In that case, think of Yogaraj Gugul as a prakshep of choice along with Maharasnadikvat or Amavad. Patient Srotorod the main karan is Srotorod in this case. So Yogaraj Gugul is the prakshep of choice in this. So this is a sutra Srotorodha Balabhramsha Gavrava Nira Mudata Alasya Apakti Nishtiva Malasanga Aruchik Klamat. So the middle column tells you about Lakshan, tells you about signs. The first column tells you about why these signs are. The main karta of sign is Srotorod, Anilamudata, Apakti, and Malasanga, and for which the third column is related to the treatment of it. So अनुपान के अनुरूप कल्प निश्चिति और प्रक्षेप के अनुरूप कल्प निश्चिति. In case of आम, there are three main things. कम समय में तैयार होने वाला, जो तात्कालिक परिणाम दर्शाने वाला हो या दीर्घकालीन परिणाम दर्शाने वाला. मध्यम समय, कम समय में that is in say maximum in 7 to 10 days. If it is madhyam samay, then it takes from 7 days to 6 weeks. And in case of ज़्यादा समय में तैयार होने वाला, it will take from 6 weeks to 3 years, 5 years. So कम समय में तैयार होने वाला और तात्कालिक परिणाम दर्शाने वाला आम तंद्रा, निद्रा, अजीर्ण, अतिसार ऐसे सिम्टम्स दर्शाता है. कम समय में तैयार होने वाला दीर्घकालीन परिणाम दर्शाने वाला अलसक और विष ये दर्शाता है. मध्यम समय में तैयार होने वाला आम जो तात्कालिक परिणाम दिखाएगा वो है दद्रु, रक्तपित्त एवं शीतपित्त. दीर्घकालीन परिणाम दर्शाने वाला प्रवाहिका, सामसंधिगतवाद, अर्श. ज्यादा समय में तैयार होने वाला जो आम है वो दूषी विष, तात्कालिक परिणाम इमीडिएटली दूषी विष और विसर्प दिखाता है, परंतु ज्यादा समय में तैयार होने वाला दीर्घकालीन परिणाम दर्शाने वाले जो पेशेंट हमारे पास बहुत आते हैं, से सोरियाटिक आर्थराइटिस, प्रमेह, एककुष्ठ, उदर, ग्रहणी जैसे बड़े बड़े व्याधि, ये ज्यादा समय में तैयार हो, बहुत दीर्घ काल आम निर्मिति, आम संचिति, आम लीनत्व ये इनमें चालू रहता है और बहुत अंदर अंदर के धातुओं में जाकर ये वहाँ पे संचित हो जाते हैं और अलग अलग उसके लिए ट्रीटमेंट करनी पड़ती है. दोष के अनुरूप कल्प निश्चिति, जैसे हमने पहले चिकित्सा सूत्र के अनुसार देखा, बाद में स्थान के अनुसार कल्प की या द्रव्यों की निश्चिति देखी, उसके बाद हमने अनुपान के अनुरूप ये कल्प निश्चिति देखी. वैसे और एक इम्पॉर्टेंट बात है जो मेरे प्रैक्टिस में मैं यूज करता हूँ और वो है दोष के अनुसार कल्पों की निश्चिति. दोष के अनुसार कल्प निश्चिति होने से पहले हमें लक्षणों के अनुसार कैसे उसे इवेल्युएट करना है वो देखते हैं. पहले दौर्बल्य दिखाई देता है, बाद में शोष, बाद में दाह, बाद में शूल. ये लक्षण मेनली न्यूरोपैथी में दिखाई देता है. इसमें एक्यूट स्टेज जो है वहाँ वो वातपैत्तिक रहती है. सब एक्यूट स्टेज ये वात कफज और क्रॉनिक ये वातज होती है. इसमें अलग अलग व्याधि आ सकते हैं, ज्वर हो, वातरक्त हो, रक्तपित्त हो, कुष्ठ हो, विसर्प हो, इस तरह के व्याधि इसमें दिखाई देते हैं. अभी अगर दोष के अनुसार मैं कल्प निश्चिति को देखूं तो बाधिर्य यह लक्षण जो पहले दिखाई देता है वो वात कफज संप्राप्त, कफ प्रधान अनुबंधवात ऐसा दिखाई देता है, जिसमें गंधर्व हस्त्यादि, अष्टवर्ग कषाय, भद्रदार व्याधि, सहचर आदि ऐसे कल्पों का सेवन हमें करना चाहिए. धान्याम्ल धारा, एरंड मूलादि बस्ती, इस तरह के कफ प्रधान, प्रायः कफ प्रधान चीजों का हमें ज्यादा ध्यान देना चाहिए। इन केस ऑफ बाधिर्य, चिंसादी, बलागुड़ुच्चादी, पिंड तेल कैन बी यूज्ड। If a patient of Dah comes to you, then it is Vata Paitik. Think of Mashatma Guptadi, Shatavaryadi, Kshiradhara, Tailadhara, Annalepan, and Yashtyadi tail is to be used. One thing one should remember, if a patient of Badhirya, if a patient of Vata Kafaja Samprapti, Kafa Pradhan Samprapti comes to you, and you give Vata Pittahar medicine, then there is no problem as such. No problem. There is no loss. But a patient of Daha comes to you, a patient of Vata Paitik Samprapti comes to you, and you use Ashtavarga, Bhadradhara Vyadi, Sahacharadi, then patient gets more side effects. Pitta is to be tackled very, very carefully. The third one is Shosh. In case of Shosh, it is Vata Pradhan. In case of Vata Pradhan, think of Baladi, Sarvangadhara, Shashtikshali Pindasve, think of Mashatel, etc. So this is very important. All these cases, in case of neuritis, remember these are all Svedan Varja Rugna. दोष के अनुसार कल्प निश्चिति करते समय think of these three signs. Shula Sphurana Shosha. If Shula Pradhan Samprapti is there, it is Vata Pradhan Samprapti. Think of Rasna Saptak, think of Mahayogaraj, and think of Kshirapag as Rasona Kshirapag. If it is Spurana Pradhan Samprapti, then think of Sahacharadi as Quad, Trayodashanga Goguru, and Ashwagandha Kshirapag is to be used in these cases. A patient of Shosha Pradhan Samprapti comes to you. Think of Dhanvantaram Quat, think of Panchamruta Loha Gugul, and think of Nagabalak Shirapak or Balak Shirapak. So all these Shirapak are to be used in case of chronic diseases. Whenever you cannot use Kruta, please think of Siddha Kshira as main drug of choice, as Balya medicine. So first is Chikitsa Sutra Anusar, second one is Sthana Anusar, third one is Anupan Anusar, fourth one is Dosh Anusar. Medicines are to be used. According to Rogagnata, we can use different kalpa. So you can think of these three kalpa: Mahavat Vidvans, Ekangavir, and Vata Gajankush. In case of Mahavat Vidvans, these black things are related to Dhatu, and these red things are related to Vanaspati, Jangal and Audbid, Parad, Gandhak, Nag, Vanga, Loha, Tamra, Abrak, Tankan, and Pippali, Marich, Shunthi, and Bachanag are used in Mahabhat Vidvans. In case of Ekangavir, Trikatu is there along with Kantaloha, Vanga, Nag, Tamra, Abrak, Tikshnalu. In case of Vata Gajankush, Makshik, Hartal, Tankan are used along with Pathya, Shrungi, Bachanag, Marich, Pippal, the Trikatu plus Agni Mantha. So these Bhavana Dravya are there in Mahavat Vidvans, Ekangavir, and Vata Gajankush. In this case, if Stambha and Shushkata is there, it is written in Rogagnata. If Stambha and Shushka are two main prominent predominant symptoms are there, then think of Mahavata Vidvans Ras as a drug of choice. In case of mouse shaithilya, flaccidity of muscles, plus Jirnatva is there, plus Vata Pradhanya is there, then think of Ekangavir as a drug of choice. In case of Jirnatva plus Stambha. Think of Vata Gajankush as a drug of choice. It is mainly used in neurological conditions in case of all Vata Vyadhi. So, Rogagnata, don't go logically in case of Rogagnata of Rasakalpa. Please read it carefully. It is very much important because Munireva Vijanati Dravya Sanyogaja Phalam. Muni only can understand the Phala Prapti of Dravya Sanyog. So, this is related to Mahavat Vidvans, Ekangavir, and Vata Gujankush. So, right now we have studied 4 different parts. There are few more parts also, but we will not go into details of other things. The first we talked about Chikitsa Sutra. The second we talked about Sthana Vaishishthya. Third was related to Anupan. Fourth one was related to Dosha Ghnata. According to Dosh, how medicines are used. In case of Badhirya, think of Vata Kapha. In case of Daha, think of Vata Pitta. In case of Shosh, think of Vata Pradhan Samprapti, and go ahead with these medicines. Select medicines accordingly. And the last one was related to Rogagnata. Please read carefully all the Rogagnata related points, and then only use the medicines properly. According to Vyadhi Avastha, one should use the medicine. So, with the 4 points covered, right now I would like to conclude this session. There are many other points also, but we will restrict our study with this, and I would like to congratulate Vaidya Chinmay Phondekar for this wonderful drug related making of different drugs and designing of drugs, which is a beautiful subject. There are so many aspects related to it. There are so many aspects related to only Vanaspatija Dravya, then Vanaspatija plus Pranija plus Khanija Dravya. Different types of Rasakalpa are there. How they have designed is something very mysterious. Only I would like to tell is Munireva Vijanati Dravya Sanyogaja Phalam. Thank you. Thank you very much. If you have any questions, please you can ask me.
Hello. Hello. Hello.
Yes, madam.
Thank you for nice session, sir. I'll just wanted to know about the Churna Basti you said, na, the proportion like in what
Then,
proportion the churna should be taken and what's proportion like to what the procedure. Can you please tell it once more?
yes, 10 to 12 grams of churna, say Vaishwanar churna, 12 grams of churna we take. 12 to 40 grams of churna can be used in case of churna basti, but we use only 12 grams because it is very tikshna in nature. Then we add 240 ml of lukewarm water into it. Then after say half an hour or say 45 minutes, we filter it and then we administer then we administer it through basti, and it gives you immediate vedana shanti. It is shulahar basti. From dosh can travel from shakha to koshta with the help of srotas shuddhi. So we can use this churna basti, and it is very effective also It is very economical also and very easy to use. So Vaishwanar Churna Basti is a very simple technique. You also can use it.
Sir, and like how many bastis like from your experience, like how many bastis we need like Purna to for the arm to get this reduced in the body,
It
like.
takes minimum 3 basti to 7 basti. We administered minimum 3 to maximum 7 basti. Vruddhya Vishyandanat Pakat Sroto Mukha Vishodhanat. On these basis, we use this basti. Minimum 3, maximum 7.
And
After
they need
three,
to be given.
after
Yeah,
three
yeah.
basti, a patient tells you about his Sweda Pravrutti. Before that, he doesn't get Sweda Pravrutti proper. After 3 to 5 basti, he gets proper Sweda Pravrutti. Shula Prashaman is there after third basti, third to fourth basti. And after that, we can stop basti. After Laghav and everything, we can stop basti.
So they need to be given on alternate days, or we can give in a continuation, like.
We have to give it in continuation.
Okay.
We have to give it in continuation.
Can this basti be useful like in case of like Badhirya, Pada Badhirya and Jadatva, like Kapha Pradhan Vat condition?
I didn't get your question.
Like if you have the Pada Gaurav and Badhirya in Kapha Vat condition, will this basti help in it is a stani like it is not Sarvadin.
See, it is a small combination of Vaitaran Basti only. Vaitaran Basti is more Tikshna, Churna Basti is less Tikshna. In case of all indications of Vaitaran Basti, you can use Churna Basti.
Okay, thank you, sir.
In case of Kapha conditions only, we have to use Churna Basti. In case of
Yes.
Vata Pradhanya, we have, if it is Shosha Pradhan Samprapti, then you have to use Anuvasan only.
Yeah. So like Anuvasan like of Saucharadi will help in.
Yeah, again, a selection of tail is very important. In case of Vata Kapha Samprapti, you can use Sahacharadi. In case of Gati related problem, you can use Sahacharadi. If it is case of say Pakvashaya Gatavat, think of Bruhat Saindhavadi or Saindhavadi tail. If it is associated with say Vata Kaphaja conditions, like go ahead with Punarnavadi tail. Or Dhanvantaram if it is condition of say Mehi patient, Pramehi patient. Then think of Dhanvantaram tail, like that.
Okay. So if the patient is Pitta Prakruti, then can this like Brosendavadi and this oils be it will be you can't.
In case of Pitta Pradhan conditions, think of Yashti or think of Bala tail as a drug of choice.
But if there is a Samata associated, then we can't use that, sir.
Okay. In case of
Samata is there, Pitta Pradhan is there, but Samata is also there along with that.
in case
Then
of Pitta Pradhanya plus Samata is there, think of
hmm,
Tiktaras first for Pachan,
Guruji.
like
Hmm.
Sariva or Patol or Bhumya Malki or Bhrungaraj, like that for say 3 to 5 days. Pachan is important. Then go ahead with Shodhan. Don't go
Okay.
for Shodhan.
Okay. So like internal Shodhan and then later on which this internal Shaman and then Shodhan will go.
Yes, yes. Internal Pachan is very important. No? Otherwise, don't go for Anuvasan.
Okay, okay, yes. Thank
It
you,
will
sir.
create more harm.
Yeah, yeah, yeah. आणि अजून एक सर विचारायचं होतं की पक्वाशयगत आणि आमाशयगत ह्याचं अजून तुम्हाला हे करता येईल का, म्हणजे अजून थोडं विस्ताराने थोडं सांगता येईल, कारण की थोडं ते कन्फ्युजिंग राहतं नेहमी.
Hello. In case of Amashayagatavat, first you write down Amashayagatavat and Pakvashayagatavat. Lakshana of Amashayagatavat and Pakvashayagatavat, then Chikitsa Sutra. Chikitsa Sutra you can get in Charak Vimhanstan, that Amashaya Samuttanam Nikaranam Prachana Bhamala Apatarpana Karmani Bhavati, etc. And Lakshana you can see in Amashayagatavat and Pakvashayagatavat. In water to achieve efficiency. Dr. Arjun, your mic is on. I think your mic is on. You want to ask something?
Hello.
Yes, sir.
Yes. Thank you very much, sir, for this elaborative session in with clinical aspect.
तर एक अजून विचारायचं होतं सर.
Yes.
Yes, madam. Please go ahead.
कधी कधी दोन्ही असतं ना, आमाशयगत वात पण असतो आणि पक्वाशयगत पण असतो. मग अशा वेळेला कुठलं ड्रॉप चॉईस करावं, असं की दोन्ही ठिकाणी ते योग्य प्रकारे आपल्याला उपयोगी पडेल असं.
जनरली मैंने खुद देखा नहीं है आमाशयगतवात और पक्वाशयगत साथ में रहते हुए. फर्स्ट थिंक ऑफ आमाशयगतवात ओनली, और आमाशयगतवात में पाचन ये करना, पाचन आदि हम करेंगे, और मतलब एक ही हो सकता है, आमाशय समुत्थ या पक्वाशय समुत्थ, इनमें से एक ही होता है, दोनों नहीं होते. मैंने नहीं देखे हैं दोनों ऐसे. और ये हम रोग निर्मिति के वक्त कौन सा अवयव इन्वॉल्व रहा है, इसके बारे में है ये आमाशय समुत्थ और पक्वाशय समुत्थ. रोग निर्मिति के वक्त समझो आमवात है, ऐसे पकड़ के चलिए, आमवात आमाशय समुत्थ, पर ऐसे पकड़ के चलिए कि ये आमवात का पेशेंट है, वो पक्वाशय समुत्थ विकारों से पहले हुए, पक्वाशय समुत्थ दोष दृष्टि पहले रही और फिर बाद में उसे आमवात हुआ. तो ये आपको हिस्ट्री से, हेतुओं से पता चलता है और उसके बाद हम ट्रीटमेंट करते हैं.
सर आणि दुसरं एक विचारायचं होतं की थायरॉइड सारख्या केसेसमध्ये ज्या ठिकाणी शोध असतो, अशा वेळेला मग ती संप्राप्ती कशी माहीत धरावी, म्हणजे ती स्थानिक आपण एक धरतो त्या ठिकाणी, त्या अनुषंगाने तुम्ही जसं सांगितलं तसं ट्रीटमेंट करू, आणि एक सर्वागत म्हणजे मग ते सुरुवातीला काय सुरुवात होईल त्या अनुषंगाने मग सुरू हे करायचं का, लाईन ऑफ ठरवायची की कशाने सुरुवात झाली ती. म्हणजे
आयुर्वेदिक निदान पद्धति ये आप पूछ रहे हो, तो इसमें ऐसा है कि सबसे पहले यू हैव टू थिंक ऑफ द कार्डिनल साइन, दैट इज प्रत्यात्म लिंग ऑफ अ पर्टिकुलर पेशेंट. समझो एक पेशेंट आपके पास शूल, ये गुल्फ संधि शूल ऐसे लेके आया, तो दैट विल बी द प्रत्यात्म लिंग. प्रत्यात्म लिंग ये दरवाजा है आयुर्वेदिक निदान पद्धति का. फर्स्ट स्टेप इज दोष निश्चिति इन केस ऑफ आयुर्वेदिक निदान पद्धति. और दोष निश्चिति में भी आप वात वृद्धि है या वात प्रकोप है, उसके बाद हमें देखना, मतलब वात वृद्धि होगी, बाद में वात प्रकोप होगा, बाद में चरक सूत्रस्थान 17 में जो है कि हीनवात, मध्यम पित्त, कफ प्रवृद्ध, इस तरह के अलग अलग परम्यूटेशन कॉम्बिनेशन है, उसमें किसमें उस परम्यूटेशन कॉम्बिनेशन में कहाँ आपका कार्डिनल साइन फिट होता है, ये देखकर पहले हमें दोष निश्चिति करनी पड़ती है. इफ अ पेशेंट ऑफ हाइपोथायरॉयडिज्म कम्स टू यू, वो स्थूल पेशेंट है या कृश पेशेंट है, दैट इज द फर्स्ट स्टेप. स्थूल पेशेंट में दोष दृष्टि अलग और कृश पेशेंट में दोष दृष्टि अलग होगी. बाद में आता है धातु, धातु की निश्चिति, धातु के दुष्टि की निश्चिति. बाद में है दोष धातु, मल, उपधातु, ये इन सब के बारे में फिर स्रोतस दुष्टि निश्चिति, ऐसे डिटेल हमें हिस्ट्री लेनी पड़ती है. ये लेने के बाद इसके पूरे टेबल्स है सिर्फ, और ये टेबल आप एक बार अच्छी तरह से भर लो तो आपको समझ में आता है कि कौन सा व्याधि है, उद्भव स्थान क्या है उसका। मैंने पहले भी कहा वैसे कि देह, इंद्रिय, मन, संताप ये आपको सिर्फ दिखाई देते हैं, दिस इज जस्ट अ मैनिफेस्टेशन ऑफ ज्वर, पर है उसकी आमाशय समुत्थ संप्राप्ति। तो आपको चिकित्सा आमाशय समुत्थ ही दोषों की करनी पड़ेगी, नहीं तो तब तक वो व्याधि ट्रीट नहीं होगा। वैसे ही हाइपोथायरॉइडिज्म का रहा, वैसे ही प्रमेह का रहा। आपको अवस्थानुरूप जब चिकित्सा देखनी है तो साम निराम अवस्था, फिर असेसमेंट ऑफ आम करना है, तब उसकी साइट वो कहाँ पर है, आम कितने दिनों से है और कितना लीन हुआ है ये भी देखना पड़ता है। मतलब अगर पेशेंट आपके पास बार बार स्टीरॉइड लेके आता है तो आम तो है पर वो लीन हुआ है, तो लीन मतलब धातुओं के फोल्ड्स में गया हुआ, तो उसे निकालने के लिए विषद्रव्यों का, एंटीपायरेटिक विषद्रव्यों का, ज्वरघ्न विषद्रव्यों का प्रयोग करना पड़ता है। तो ये सब आपको तरतम भाव से देखना होगा और फिर उसके हिसाब से चिकित्सा करनी पड़ेगी। आपने क्वेश्चन पूछा था रिलेटेड टू थायराइड क्या करते हैं, तो मेनली रसवह स्रोतस, मेदोवह स्रोतस और मांसवह स्रोतस की दृष्टि होती है। तारतम्य से देखा जाता है कौन सी स्रोतस दृष्टि कितनी है और दोष कौन से है, अकॉर्डिंगली वी कैन ट्रीट।
ओके, थँक यू सर. पण ह्याच्यामध्ये मॉडर्न मेडिकेशन सर चालू रहता है पेशेंट का, तो वो लाइक we can reduce it in some proportion and give a medicine, then it will be more effective na, then just going along with that.
इसके लिए मॉडर्न मेडिसिन का ज्ञान भी आपको बहुत ही अच्छी तरह से होना बहुत जरूरी है अच्छी आयुर्वेदिक प्रैक्टिस करने के लिए। अगर वो ज्ञान नहीं रहा तो सिर्फ हम लीन दोष या दूषी विष ऐसा विचार करते हैं, पर इन डिटेल अगर आपको उसके मेडिसिन से उसको बाहर निकालना है और अच्छी तरह से ट्रीटमेंट करनी है समझ लीजिए, तो आपको दोनों का ज्ञान होना जरूरी है। स्टीरॉयड डिपेंडेंट केसेस रोमेटोलॉजी में कितनी आती है, कम से कम 1.5 महीना लगता है मुझे खुद को कि वो मेडिसिन से वो पेशेंट बाहर आए, और पेशेंट वो मेडिसिन के साथ रहे या पेशेंट मेडिसिन में बाहर आए इस पे यश नहीं रहता। 1.5 महीना या 3 महीना या 6 महीना भी पेशेंट विथ स्टीरॉयड रहता है मेरी ट्रीटमेंट के साथ, धीरे धीरे ही टेपर होता है वो। और इसमें ऐसा नहीं है कि हम हार गए या जीत गए, ऐसा नहीं है। पेशेंट बेनिफिट, उपशय टू पेशेंट इज वेरी इंपॉर्टेंट। वो टेपर हम कर सकते हैं, हमें उसका ज्ञान होगा तो हम जरूर टेपर कर सकते हैं।
सॉरी, वंस अगेन आई विल आस्क अबाउट थायराइड ओनली, कि अगर स्थानीय उदर का जो शोध अगर कम हो रहा है तो वो क्या साइन, व्हाट डी लाइक इंडिकेट्स लाइक दैट वी आर ऑन द राइट ट्रैक, और लाइक to how if in hypothyroid like there is a large like शोथ है, गले की जगह बहुत शोथ है, तो वो अगर बहुत अच्छी तरह से कम हो गया है तो like how much like we have come to the this giving a good treatment like we can indicate what is that stani, what that indicates like
आप गॉइटर वगैरह उसके बारे में पूछ रहे हो या हाइपोथायरॉइडिज्म के बारे में पूछ रहे हो?
hypothyroidism.
हाइपोथायरॉइडिज्म में फिर आप रेगुलर पैथोलॉजिकल इन्वेस्टिगेशन कीजिए ना, हर 3 महीने बाद आपको इन्वेस्टिगेशन करनी पड़ेगी और देखना पड़ेगा। उसमें शोथ होता ही है, ऐसे नहीं है, उसमें थायराइड की जगह पर शोथ होता ही है।
in cases which are having शोथ like in that cases I'm asking,
तो उसमें दोनों मतलब स्थानिक भी चिकित्सा आपको करनी होगी वो शोथहर, और टीएसएच कम होने की भी दवाई लेनी पड़ेगी।
okay sir, thank you.
I think all questions related to today's topic are over now. We may conclude today's session. Thank you very much, sir.
Thank you very much, Dr. Chinmay Pondekar, and congratulations for your wonderful subject. Thank you.
Okay.
Thank you, sir.